Hello, everybody. Welcome to today's Firelight Chat. We're starting a series of conversations where we will be talking about issues related to my whole health plan. And you can read about the whole health plan at Marianne2024.com in the issue section. The issue is not just how are we going to pay for healthcare. For that, I definitely support Medicare for all. But we need to do more than that. We need to think about what I mentioned on the debate stage in last time's election, and that is that we have a sickness care system more than a healthcare system. We have a much higher rate of chronic illness than they do in other advanced democracies. We have to deal with the fact that so many Americans are sick, not just how we're going to treat them. And so my whole health plan involves a more holistic, whole person aspect of healthcare because it genuinely is healthcare. We need to address the issues that are involved in making people healthier and also facing all the issues in which we, policy after policy, actually contribute to the lack of health on the part of American citizens. This has to do with our food. This has to do with our environmental policies, as well as insurance, pharmaceuticals, hospitals, healthcare, and so forth. So let's start tonight. We're going to be talking to Dr. Steve Farber. He is a hospitalist in a small town in southern Arkansas called El Dorado. He is a board-certified internist and cardiologist. He has practiced cardiology for 25 years in Texas. He's worked in nursing homes and skilled nursing facilities for several years. He was the creator of a healthcare collaborative in Texas, and he is a certified meditation instructor and has authored 2 books. Behind the White Coat is one of his books, Reflections on Being a Doctor in Today's World, and a book called As Sick as Our Secrets. When I meet a cardiologist who is also a meditation instructor, that tells me he's on to the larger recognition that there's a bigger story here than just mechanistic healthcare. He's a cardiologist, yes. He understands the physicality. After all, he is a physician, but he also understands that there are a lot of issues we need to address here other than just the specifics of how to treat disease. All right, please join with me and welcome Steve Farber. Farber, thank you so much for being with us. I'm grateful.
Yeah, thanks for having me, Marianne.
Well, you have had a long career, 30 years. You've seen how the healthcare system in the United States works. You are a doctor yourself. You've seen what has to go away, and you've also seen how we have to do things differently. Can you tell us a little something about your own experience?
Well, I've been a cardiologist for 25 years, and currently I'm a hospitalist in a very small community in Arkansas. And I've seen people who have not been able to get healthcare the way that I'd like to be able to provide it. I feel that there's so many people who can't afford their medications, who don't have access to affordable healthcare. And I've seen people needlessly get sick. And it's very frustrating because I've learned a lot about medicine, learned how to prescribe hundreds of medications, but they really are not helping the patients, but they can't get them because they can't afford them. And that includes cardiac medications, insulin, and I've seen people really die from this over the course of years, and it's very frustrating.
Okay, so let's talk about the statistics here. 85 million Americans are underinsured or uninsured, and 18 million Americans cannot afford the prescriptions that their doctors give to them. And 68,000 Americans die every year from lack of health care. What you're saying, Steve, is very typical, what I hear doctors say now. Dr. Victoria Dooley in Detroit said to me not too long ago, 10 years ago, when I would prescribe a medicine or a treatment, people were most likely to ask me what the side effects were. But today, they usually ask me how much would it cost. And so what you're saying is very typical of doctors these days. They say, I know what to tell my patient to take. The coverage that the patient had got them the doctor's visit, but would not cover the medicine that the doctor said that they needed.
Exactly. And one of the first questions, again, is, can we afford it? Does insurance cover it? And again, if the answer is no, we have to try something totally different. But that is the first question nowadays. You're absolutely right.
So this is all the more reason why we absolutely must have universal health care.
Absolutely. There has to be coverage. There has to be some control of costs for pharmaceuticals. There has to be. We can't go on like this. We're probably the only country in the civilized world that
we're the only advanced democracy or any advanced country, you're right, that does not have universal health care, and we spend the most, and we have the least productive results. And as you yourself have said, it's not because we don't have the doctors, it's not because we don't have the people who understand what to do, but because the system is such that the pharmaceutical companies and the insurance companies, their greed basically is so dominating the system that it forms a gridlock, and it keeps people from getting the services. One of the things that you just mentioned was insulin. In no other advanced country are people rationing their insulin, but in our country, I read it's 1.3 million people ration their insulin.
Well, we make all these great drugs, and the newer drugs aren't always better than the older drugs. But really, what's the point of all of these newer drugs that are like really in the higher tiers where insurance won't cover them? And what's the point of this? 90% of the population and 95 can't afford to take them. And I think part of the argument on the part of drug companies is the research and development argument, that they need to charge all this money to be able to do research and development. They only have 10 years before they go a patent, et cetera. But really, the reality is a lot of money spent on advertising you see on television that goes to, I'm sure, to pay the pockets of a lot of very rich executives. And the cost of these medications is just outrageous. And it's not, and it's hurting people. It's really literally hurting people and killing people.
I think it's literally killing people.
Literally.
Yeah, literally. And also, when you talk about research and development, they don't need to do a lot of research and development on insulin. It's already been researched. It's already
right,
been
exactly.
Like you said, these newer iterations of drugs aren't even necessarily better. So what I'm seeing, and you're not the first time I've seen this, Dr. Farber, it's like, not only am I seeing this sense of helplessness and hopelessness and just frustration and just such sadness in patients, I'm seeing it in doctors as well. As you yourself have said, it's keeping you from being able to practice what you could do in terms of helping people.
Yeah, I can't help people on a level that I'd like to help them on. And basically good intentions and knowledge only go so far. And, and the rest, I think, has to be the ability to take part in their healthcare and get their medications and provide access to and get access to preventive medicine, because really preventive medicine is what's needed in this country. We have to focus on
the fact you're a cardiologist when it comes to heart health, absolutely. So can you tell us a little about that? Talk to us about, I know in my own agenda, I have something called the whole health plan, because as you have said, we don't have a healthcare system. We have a sickness care system.
Totally,
we have a much higher rate of chronic illness, including heart disease in the United States than in other countries. A lot of this has to do with our environment, our food, and so forth. So what to you are the most important issues involved in preventive healthcare?
Well, I think that prevention is basically the only way to decrease the cost of healthcare in this country, number one. And number two, I think from the standpoint of public health issues, communicable diseases, things along those lines, we need to act more on the preventive side of things. Part of the problem, Marianne, is that as a physician, I see what's happening with reimbursements that physicians actually emphasizes more intervention than prevention. Doctors are paid by the government, by all the insurance carriers, more for interventional type of work, and not really reimbursed well to do counseling of patients on diet or exercise programs. And again, we can tell people about these things, but again, it's also not a personal responsibility. People have to be able to follow the instructions, be willing to follow instructions and education, and willing to be educated and educate themselves. But again, doctors, by and large, I think one of the things that bothers me about medicine is that we become more automated and less personalized. I think doctors spend less time with the patients, really teaching them about things, and spend more time behind a computer and trying to take notes on patients, spend less eye contact with patients, spend less time educating them. And a lot of patients educate themselves when they come to the office. They know a lot, they know more because of the internet. But still, I think doctors need to be able to spend more time. And I think the way medicine's become more of an assembly line with patients coming in and out of the office. And that's because of doctors, I think, look at patients more as a commodity, let's put that, than they do as sometimes as individuals and as people. And that's sad.
Well, that's the economic system that now dominates, is one in which all people are commodities. It's almost, there's something inhumane about the system today. Mm-hmm. And this is why you see such sadness and anxiety and depression in people. And as you're saying, it's not just in the patients, it's in the doctors as well, because the joy is taken out of things when it's just a computer line and it's an assembly line, as it were. In articulating, I think people have really gotten to the point, Dr. Farber, where people realize, I think a critical mass of Americans realize something is really wrong. And my sense is that a critical mass of people also realize that it's the financialization of everything that is the sort of suppressant on the system. But at the same time, we have to articulate what we want. We have to articulate a new way of doing in order to figure out how to effectuate that. So can you describe, you have a lot of experience with what's wrong. Talk to us about what it would look like if we did it right in terms of prevention, in terms of food, in terms of lifestyle, in terms of all of the things that need to change. How would you see those changes happening? And what are the things you think all of us could do and the government could do to help effectuate those changes?
So part of the paradigm shift that I'm talking about here is that really things need to be more grassroots. There has to be grassroots effort in healthcare. And one thing I've learned over the course of time is that we can't count on the federal government to solve problems for us. We have to also be able to work on it. First, it has to start as an individual type situation. That's the microcosm. It has to start at home. It has to start with the individual. And then I think basically more go into the macrocosm of the community. My own experience actually, I think, has taught me a lot with an organization that I founded called Heart of Montgomery County in Texas. And what that was essentially was a healthcare collaborative, a grassroots effort that started actually with 5 people and sitting in a room. Okay, me, a businessman, a housewife, and 2 communications people who wound up being incredibly valuable to this effort because communication was a big part of what we were doing. And what we did was we tried to determine what we needed to do to help the community because of all the frustrations that so I wasn't the only one who saw this, people in the community, like you said, everybody sees the problems. The question is, how to solve them. And one size does not fit all. But the needs of a small community in Arkansas or in Conroe, Texas, are very different than a community in California or in the community I live in now in Carlsbad. They're very different resources. They're very different problems, homelessness, drug abuse, things along those lines. So I think part of the paradigm shift to doing preventive care has to start on a grassroots level and in communities. And I think people need to feel empowered with their healthcare. I think the empowerment is incredible because I think a lot of people are hopeless. There's nothing we could do with the system. The system's broken. How do we change it? It's a 1,000-pound gorilla. And it's standing in the way of fixing healthcare. So I think each community has its own resources, okay? And I think that each community needs to strategically plan and determine what resources are necessary and what resource they have and exactly what problems they have and what they need to do to try to solve those problems on a local level. The group that I found actually was a collaborative nonprofit called Heart of Montgomery County, like I said, and our mission basically was to provide access to affordable health care for all the residents of the county. Access was a major issue. Not everybody had equal access. And of course, the affordability goes without saying. And so what we did was actually we got a group of people, started with 5 and then eventually went to 25 and then 50. Everybody is a stakeholder in their healthcare. And I think everybody in the community is a stakeholder. And we actually eventually got politicians involved, business leaders, community leaders, and eventually we wound up coordinating with Gateway to Care in Houston with Rob Mosbacher. And we basically formed a regional collaborative between Houston and North County and basically worked together. The miracle I saw with this was probably the most amazing miracle of my career. And that is that we saw people sit down. It doesn't matter with what political party they were. It didn't matter whether they're liberal, conservative, and actually people saw that we were really not a political organization, that we didn't have a political agenda, and they saw that we really wanted to help people. And they actually sat down at the table. We wound up getting the critical mass of people to where people said, hey, I want to jump on the bandwagon. And our goal was to educate people. And one of the biggest obstacles that we saw was the lack of education in the community. People didn't know what the problems were, how to solve them. And we had programs, for example, mental health task force to help children and adolescents deal with their psychiatric issues. Montgomery County had the highest suicide rate for teenagers, adolescents of any county in the state of Texas. And that was for 5 years in a row. Okay. There had to be a reason for that, why that was the case. My son, unfortunately, was one of those. And I think we had people come across actually who had had experience, who wanted to help and prevent other children from having the same, outcome. And we established programs for like that. We established, other programs as well to help people get access to care and basically not use the emergency rooms as much. Okay, there's a program called Save the ERs, basically. And that was basically to help people prevent people from going to the ER by establishing good primary care and not use the ER as a primary care facility, which is the most expensive form of healthcare. Okay.
Well, first of all, I want to say, if I heard you correctly, my deepest condolences to you. I'm so sorry.
Yeah, my son took his life a number of years ago. And I think part of the thing that one of the biggest problems, Marianne, is that there's a stigma regarding mental illness in this country, which is really horrible. And the way to get rid of that stigma is through education. That's one of the ways to educate people that mental illness is not this horrible type of thing, that people shouldn't be outcasts for that. But children, everybody, actually, I think we've gotten to the point where people are afraid to come forward. And one of the things that was a blessing in this, as an outcome of this, is I know we've saved some lives. I've heard stories of, we had a program essentially where we gave children, adolescents cards, and that were basically that said, if you have a problem, please go get help. And these cards were distributed and basically throughout schools and not given to children, people could be given those cards if they was felt that they had, any kind of mental illness, very, quietly and discreetly. And one teenager took this card to a counselor and said, I really am having problems. I'm thinking of taking my life. And I think so, and I know that we've helped adolescents and children. And I think this problem's gotten worse since COVID. I have no doubt that mental illness needs to be addressed really in much more depth. We're horrible in this country at giving mental health care. I think that, to me, is one of the biggest problems I've seen in this country, is the lack of mental health care.
Well, I think that so many of the things we're talking about with the healthcare system apply to so many things in this country where people feel so beaten down by the system. And that is the source of these mental health problems. It's not a mental health problem that came out of nowhere. It's a mental health problem that is a result of the way we are ordering our society these days. And we have to really dig deep, it seems to me, to all the ways in which we have to get back to the care for one another that is the solution. They say in AA, every problem comes bearing its own solution. And it is beautiful how you've turned your own grief and tragedy into medicine for others. Dr. Farber, I've heard you talk about the role of insurance companies and pharmaceutical companies. Can you tell us what you think about that?
Well, I think that the pharmaceutical companies, the insurance companies, control medicine the same way that the National Rifle Association controls gun control. Basically, the gun control can't be something that's done in this country because of the lobby, big lobby from the NRA. And I think the pharmaceutical companies and the insurance companies have the same kind of lobby in Congress as well, prevent the right thing from being done. And unfortunately, people suffer and die from that because of that.
I want to go back to something you said a few minutes ago when you said we have to get over the belief that government is the solution to our problems, because I think that narrative is so misused. I think we have to realize how much government inaction is the source of our problems. You say government is not the solution, but excuse me, government is why we don't have universal health care. And government is the way we would have universal health care. Also, government is why there's been this orgy of deregulation since the 1980s, where you have so many ingredients in food that have actually taken the organic chi, organic juice, organic power of foods, the vitality of foods has been sucked out. That was because of government. If you look, I'm sure you read the article about the ingredients in a bottle of ketchup in the United States versus the ingredients in about ownership in Canada. And I think this is important, Steve, because I think it's a big both and. It's not either or. So it seems to me, although we do have to have far more local activism, citizen activism in these local ways, I don't think we should leave out of the formula the fact that it's the federal government, yes, that would pass universal health care. It's the federal government that would stop these ridiculous deregulation, safety factors, safety standards, and safety procedures that are so necessary. Wouldn't you agree with that?
Yeah, I think what I really meant to come across is saying, Marianne, is definitely don't want to leave federal government out of the equation because it's an important part of the equation as far as providing universal health care. But I think what I was saying in the past, but we haven't been able to rely on the government to do that. You know, we waited years. I think when I worked with this organization, it was back in the 90s and early 2000s. And, well, you know, voila, we're 20 years later and we're still, you know, not where we need to be regarding universal health care. So it's because of a lot of issues, obviously, that are out of a lot of people's control. And I think that feeling of not being able to have any control over this, other than to our elected representatives, I think it's frustrating a lot of people, giving a lot of people a feeling of hopelessness and helplessness. And I think one of the things I wanted to try to emphasize that people don't have to feel hopeless about this, but we have to elect the right people, you know, who are willing to stand up to corporations. And so far, we just haven't done that.
No, we haven't, because the PR is so extraordinary. And the money, of course, that is given by hospital associations, by the pharmaceutical industry, by the insurance companies, et cetera, have turned our government into a system of legalized bribery. And that's why the intervention has to come from the people to actually change that. Talk to me about when you do educate people and these wonderful things have happened, just like you were talking about what has happened with a mental health issue. Talk to us about food. As a cardiologist, what are the issues? Food, exercise, lifestyle. What have you seen that you want to shout from the rooftops?
I think industry is a big part of our problem because I think we have a lot of carbohydrate addicted people in this country. Essentially, I think that one of the hoaxes I think in this country is that everything's cholesterol. All the problems are eating too much cholesterol. Yeah, that is a part of the problem. But I think that one of the biggest aspects been neglected here is the carbohydrate aspect of things. And I think everything here is there's so many products that are sold that are so rich in carbohydrates. Are people poorly educated in this? Probably. I think a lot of people don't read what's on the covers and the ingredients of things. But I had a patient last week in the hospital, Marianne, that really couldn't afford food, that he was homeless, or just had no money coming in, and he ate candy. That was his way of sustaining himself was through candy. And so I think the food industry has a lot to do with addicting people to poor dietary habits, but people again have to be willing to take on some personal responsibility in eating the right things, but there are people who can't afford to eat the right things. As a cardiologist, I'm sorry.
No, I was just food deserts throughout the country where people literally have no access to fresh fruits or vegetables, correct?
Right, exactly. Or can't afford, sometimes healthy foods are not affordable to everybody. And I think that, I wish everybody had the ability to eat the right thing, but a lot of people don't have the money to do that, or the education.
So if I were president of the United States and I called you up and I said, we need to rewire this whole thing. And one of the things that I would be working on, of course, would be passage of universal health care, Medicare for all, single payer type system. But if I was, earlier today, I did a podcast with someone talking about the PFAS and the, just the poisons that are in our food and in our ground and in our water. And it's so awful. Let's say I put together a commission. Let's say I called you and I said, Steve, we're going to start changing all this. What would be the three things that you would argue were things that we could do to begin to turn this thing around?
I think one of the most important things is to change the paradigm to preventive care. And I think help physicians to do that. I think, the mechanism we have right now is that in place, they advocates intervention. Physicians are like everybody else. They want to make money, And unfortunately, procedures are done that drive up the cost of healthcare that sometimes are unnecessary. I hate to say that. But I think we need to incentivize incentivize preventive care among physicians. I think we also need to provide better access to care for people who can't afford it. We need to provide universal health care to people so that they're not out there with that insurance, that we don't have incredible 30% rates of uninsured. And a lot of that actually also is increasing because of immigration. Okay, I'm not getting into immigration politics here, but I think that the more people that we have coming to this country have to be taken care of. The people come across the border, we have to take care of these people just like we would everybody who's lived here for 50 years. For public health reasons, for financial reasons, economic reasons, it's been found that people who don't have access, who don't have insurance, whether they're here legally or illegally, doesn't matter, wind up in the emergency rooms. And the most expensive form of healthcare is the emergency room if they don't have access to primary care. And the again, that's something that there's public health issues. When I was in Texas a number of years ago, I fought and advocated for primary care for people who came across the border illegally. And I actually received a lot of negative comments for doing that. But they're really good arguments for doing that. There's leprosy coming across the border.
There is. I was reading about leprosy in the United States the other day. I couldn't even believe it.
Yeah, and there's leprosy, there's drug-resistant tuberculosis. So from the standpoint, once these diseases come across the border, we're all susceptible to those. And I think if you don't take care of people equally, that's good from a public health standpoint, it's going to be a disaster. So I think we have to provide care to everybody who's in this country, whether regardless of whether they're here or legally or illegally. And again, the paradigm shift has to be from retrospective care, retroactive care, rather, to proactive care in this country. I think we have to help basically collaboratives. I think the federal government should help fund healthcare initiatives on a more local level. I think that's really critical because I think these collaboratives can't exist without some financial backing. I actually backed this financially myself for about a year until it actually became solvent to the point where we're able to maintain ourselves financially through grants. But that takes time. Getting grants takes time, and for establishments. But I think that funding should come from the federal government to help grassroots organizations become established and sustain themselves. Because even again, with the federal government really providing universal care, dealing with pharmaceutical costs, there still are issues on local levels that can probably best be dealt with by stakeholders on local levels.
I think people would be amazed to know how much pharmaceutical company money is given to most medical schools in this country, and how little time most medical students in this country spend in their training learning about food, learning about effects of food, learning about lifestyle, and how all of those things fit into the issue of proactive cultivation of health. We look at sickness. We need to realize when you talk about this paradigm shift that sickness is the absence of health. Health is not the absence of sickness. And I do think that consciousness has begun to permeate mainstream thinking, that we have to, with our choices of food, with our choices of lifestyle, with our choices regarding exercise and so forth, proactively cultivate health. But now the next thing for people to realize is that sounds good if you can afford it. And too many people are locked out. They can't even indulge that conversation. Like you said, the homeless man who's just eating candy.
Well, the other thing that's important, I think, Marianne, is that we have to make better use of our technology and use it more appropriately. I'll just tell you a story, but I trained to put pacemakers in Sweden, in a small little town in Sweden. And when I got there, I saw how they did pacemakers and the equipment they use and the pacemakers they use. And my initial impression was, wow, this country is 10 years behind the United States. And the reality is that the pacemakers they put in didn't have all the bells and whistles that were sold here in the United States. The pacemaker companies want to sell the most expensive pacemakers here in the United States. Sweden realized, hey, we don't need those in all of our patients. Not everybody needs 99% of the population, but do fine with a standard pacemaker or a standard hip replacement, or, again, that drives up the cost of healthcare. So what I thought initially was they were behind the times. Really, they were actually ahead of us.
Absolutely. So I
And
think we should stop for a moment and really, really discuss that, because that's what's happened to this country. We've financialized everything. We've commodified everything. And of course, what you just described is the difference between a profit-driven healthcare system
right,
versus specialized medicine. So if
exactly.
the government is paying for it, the government doesn't want to pay these high costs. And of course, I think most Americans would be shocked to see how much the government could do to bring prices down, and it's chosen not to. For instance, there was a bill in 1980, the Bayh-Dole Act, that gives the government marching rights. Marching rights means that any government, any drug that is developed with even $1 of taxpayer money, which is almost everything now, that does give the government marching rights. It can go in there and lower the price of some drugs, but often, because of the lobbying of the pharmaceutical companies, the government does not use the power that it has.
Yeah, and
And
medical technology countries and pharmaceutical companies, rather, both are incredible lobbies, and they sell the most expensive products here in the United States that are not accepted in other countries.
and
One
so
of the other things, one of the other things Sweden does is, that I thought was really great, is they actually force physicians and nurses to take a month off a year. Okay, and I think I'm a poster child, to be honest with you, Marianne, for burnout, physician burnout. And for me, one of the reasons I don't practice cardiology now is because I went through a horrible burnout and depression from overwork. But they actually encourage physicians to be healthy, and they force physicians to take time off here. I mean, for the first 20 years of my medical practice, I think I worked like 16-hour days, most days of the week. And you can't help but be unhealthy mentally, physically, just from a holistic standpoint. It just, you can't take good care of people if you're not taking good care of yourself. And if you're unhealthy, it's hard to be a healthy physician if you're burned out. But I like that thought that they actually had physicians, made it a priority for physicians to not work 365 days a year.
Well, that's just true of the entire, it's not just in terms of medicine. Some of these societies that just officially recognize the importance of life-work balance, who recognize what you were saying, this is why paid family leave is also important, that people get to have time with their children, that people get to have time with their families. And then we wonder where the breakdown comes from. It's because people literally being worked to death in order to feed the system so that a very few can get richer. And then you see the breakdown that you were talking about.
And some physicians are very driven to work hard. I think when you come out of school, you realize you spend a lot of your life in school, and you want to have to really make a name for yourself and work really hard. And I think there's definitely, people want to work really hard when they come out of school. I did when I wanted to establish myself, but that can only go on for so long, before you totally lose it, essentially.
Well, I think we're seeing in some of what has been regarded as the most important professions, people saying, I'm out of here, I'm done. That's happening with teachers, that's happening with teachers. The system is clearly breaking down on so many levels. And I really appreciate you as one of the people who is articulating the changes that have to happen. Do you have any other advice or guidance? People, of course, should pick up your books. Anything else that you think people need to know and to remember in order to incubate, in our own consciousness, we're incubating this new way of doing things?
Well, I think from my standpoint, my book discusses my own personal issues with burnout and how I've basically taken the stigma away. As part of the reason I went ahead and wrote this book is that actually I became addicted to drugs because of my burnout. And I think that that's something that we need to do. That's one of the biggest reasons we need to deal with psychiatric illness, with addiction, because it is so rampant. But I think my story makes me much more open to hearing other people's stories and helping other people who have similar issues. But I think really we need to realize that. I think the major point I want to help people realize is that things are not hopeless. Is that the people can be proactive, elect the right official, the right people to office, including you, that can make changes and have the courage to make changes. And I think you have to have courage and put yourself out there. But we all can do that in our communities. It has to start at home. It has to start with the individual. and trying to do the right things for themselves and their families and their children. And we all want what's best for our children and for our parents too, because that's a whole other topic in medicine we didn't get into, is senior citizen healthcare. That's very important as well, that we do a very poor job of in our country. So there are a lot of aspects here, which is hard to cover in a short period of time. But I think that I just want to help people realize that healthcare can be improved, that the system is not something that they necessarily have to live with, and that things can be changed.
First of all, thank you for the acknowledgement. Secondly, I know that you're a certified meditation teacher. Tell us
Yeah.
about how you see meditation in relation to health.
I think it's huge. From a personal standpoint, I think it's important. I know I meditated before I came on air with you, basically to kind of clear my mind. Not everybody's open to meditation. I learned it, actually, I was taught it rather at the Chopra Center here in California, in Carlsbad, which I know you spoke in there. And I use it myself to decrease anxiety, to just help me focus mentally. And I've tried to use meditation techniques with my patients. Not everybody's open to it, obviously, and it depends. I brought it up to one of the physicians I work with, and asked him if he would use it on my patients instead of prescribing a Xanax or Valium. And he absolutely refused to. I was actually going to lead group meditations for the patients, and he really didn't want to get involved with that. But I do within the patients individually. But a lot of people want a quick fix, unfortunately, and they'll come in the office and say, "I'm really anxious, doc. I need something for it. Can please give me Xanax?" And the last thing we do is give addictive medicines to people, and Xanax is addicting. And so what I try to do is help my patients and teach very simple techniques. There's Soham meditations, or different forms of mantra meditations that are you can teach somebody in a few minutes, and also breathing techniques. I've taught some of my colleagues as physicians some breathing techniques to help them through the day, because we all deal with very stressful days. And there's some very simple breathing techniques, which is called pranayama, also, and basically things that can decrease anxiety and help you get through busy days and stressful days.
Do you know about the work of Dr. James Doty?
I don't. I've heard.
Yeah, I think you'd really like him. I'd like to put the two of you together if you're interested. He is a neurosurgeon over at Stanford Medical School. And with the Dalai Lama, he started a Center for Compassion over at Stanford. And he wrote a wonderful book called Into the Magic Shop. And he's talked a lot about neurosurgery and meditation. And one of the things that he was talking about with me once in an interview is that he said that they are learning that there's much more of a connection and a partnership between the heart and the brain than they used to know. And
Absolutely.
That there's just a whole new sort of avenue of understanding that's coming about, because they used to think that the brain was the intelligence center of the body, and now they're realizing much more of a connectivity between the heart and the brain. So I think
I agree with that.
like
Totally.
each other. Yeah, well, I'll put the two of you together if you want, because I think that would be an interesting conversation.
There's totally, like, holistically. I mean, you have to basically look at things holistically. That there's definitely a connection with meditation and heart rate and stress load on the heart. There's definitely that connection. So I truly do believe that. And I'd like to talk to him. Absolutely, connect with them.
Great. I'll make it happen. And I thank you very, very much. I thank you. I recommend your books. Everybody go get them. Behind the white
coat was the initial one.
And your thickest your secrets. And you are obviously, when we hear people such as yourself, an actual cardiologist, you're not just talking theory. You're a medical doctor, and the damage that the system that we have now does. We know how you have articulated how it keeps doctors from being able to do what they could do. And you're also pointing us to this new paradigm and to the new way that we could do it. So thank you for all of the information that you have started here and in your books, and I hope we get a chance to talk again.
Yeah, thank you very much, Marianne. I appreciate being here.
God bless you, sir.